Hello everyone, my name is Chris from Mobilisuae, and today I'd like to talk to you a little bit about plantar fasciitis. So plantar fasciitis is one of the most common conditions that we see with the foot and ankle, and it can also be one of the most complex conditions to treat. What is very important is for us to understand what is actually causing the problem. From a clinical perspective, that can be anything. It can be a biomechanical deficit in the foot and ankle, or it can be something else like even menopause or pregnancy. So when it comes to the biomechanical aspects of the ankle, one of the causes of this could be a midfoot instability. So here at the talonavicular joint, there might be an instability, and that causes excessive pronation in the foot, which in turn puts a lot of strain on the plantar fascia connecting the ankle and the first metatarsal. Another big cause of plantar fasciitis can be a unstable hindfoot, and what happens is the hindfoot, the calcaneus, gets pushed posteriorly and proximally, again putting a lot of strain on the plantar fascia. This often causes lateral aspect plantar fasciitis. Another big cause of this hindfoot posterior proximal deviation can be due to a very tight Achilles tendon. So as clinicians, we are responsible to evaluate and assess the patient thoroughly to be able to understand where the deficit is coming from. As an orthotist, that involves doing a good interview with the patient, understanding their activity levels, understanding what about their activity levels might be aggravating this problem. And to do this, we have a good assessment. We use electronic tools to assess the patient's gait pattern, and we prescribe usually an orthotic and a good pair of shoes. So at Mobilisuae, we have several options to provide the patient with relief from plantar fasciitis, like this orthosis here. And you can see this one is very nice and thin, very lightweight. And with this, we can determine where the problem is, and we can treat each aspect of the foot, whether it be the hindfoot, the midfoot, or the forefoot. This is another type of orthosis that's made of a different kind of material, which creates more flexibility and compression and shock absorption, which is also very important for plantar fasciitis. If you experience any kind of foot pain, it is very possible that you have some sort of plantar fasciitis. It is therefore very important that you get assessed and evaluated very accurately by a qualified clinician to determine where the problem is coming from, and therefore to be able to treat it.